Hey guys, I'm going to show you how to get your patient ready if they are coming back from OR with a SWAN. So you'll need your SWAN machine, which is located in our new big storeroom area. You'll need this big gray cord, but that'll actually should come back from OR with that one. You should use this cord as well. So if they're not plugged in, you're going to need to go find those cords and have them ready. The first thing that you're going to do is turn this thing on. So while that's hooking up, this piece should already be here. Your SVO2 cable should already be connected. We have 3 other things that need to get hooked up. So it's going to go blue to blue. You got to be careful. And then you're going to attach this one. This one goes in. But just be careful, there's little prongs in there, you don't want to break them off. And then it twists, and that gets connected, and then this piece will go on that CO2, cardiac output here. And those are all connected. We'll pretend this isn't a real patient. These 2 will already be hooked up. This is your proximal infusion port, so that's where your medications are probably going to be running. This is your PA distal port, and this will be where you're getting your PA numbers. So those 2 will already be hooked up, and you shouldn't have to do anything with those. If you needed an extra port to run fluids through, you can always run it here. All right, every room should have this cord here. This cord should not leave the room. We're going to turn it around, and it gets plugged in right here. Okay, then obviously it gets plugged in. I do want to point out that your numbers will not pull over here on our screen, on our Philips monitor, until we get a new SWAN monitors. So hopefully that'll be coming in the near future, but I do want to point that out in case it gets confusing as to why it's not pulling over. All right, so now that this is ready to go, your patient's all hooked up, you're going to hit continue by pushing this big button, push it in. And then we're going to go over here to SVO2. So by doing the twist, you're going to click into that box, and then you're going to come down here and click Recall OM Data and push it in. You want to make sure that all that's right, and then continue. And that's how you recall the data. And then you're going to go to in vivo calibration once you get your PA gases. So that'll be a little bit later after you draw that. So to get out of there, you have to hit return. While the provider's at the bedside, you want to shoot a cardiac output bolus. In order to do that, you're going to come here to this graph screen. So it's a soft button, you're going to push it. You're going to grab your cardiac output syringe, you're going to pull back. And at the end of expiration, you're going to make sure that's forward, and you're going to watch your patient's breathing. At the end of expiration, you're going to inject 10 mils of fluid, and that can just stay, that stopcock can stay straight out. And then you will have your waveform, which this will tell you when it's ready to inject. And then you should get a number, and it'll come over here. If it's not the correct number that anesthesia got, you want to shoot 3 and take the average of, or take the best one out of all of them. So sometimes that does happen. But that all needs to be done right when the patient comes back. About 30 minutes to an hour, once the patient has kind of got settled, they're going to draw PA gases, which you draw from your yellow port. They'll run it, they'll bring it back to you. To get out of this screen, you're going to hit the same button you got into it with, which was the graph button, and then it's going to ask you this question: do you want to do continuous cardiac output monitoring? You're going to hit yes, and that way it'll just continuously run, and you're not having to shoot these boluses all the time. So to get our PA gas, we're going to go SVO2 again, and we're going to go to in vivo calibration, and then it's going to take 23 seconds. usually it doesn't say an unstable signal, but you'll do the in vivo calibration. Well, actually, you'll hit continue probably. And then it'll tell you, you can go ahead and select draw and draw your waste, followed by your lab sample. And then here's where you will put in that ABG that respiratory will hand back to you. You'll put in your hemoglobin, your SVO2, and your hematocrit, and then you hit calibrate, which we can, sure. There you go. Say this is. Sure. Calibrate. And then it'll take a few seconds, but then it'll calibrate your SVO2 for you. These boxes here in the SVO2 box, you usually want them green. It has to do with the location of the swan. Sometimes they are red, so if you are having red boxes, if you're having red boxes over here, we may want to reassess and make sure that we have good PA waveforms, and you may want to reassess where your swan is sitting. Other things here is your cardiac output will be here in this box, but another place that you can, oh, there's our SVO2. Another place you can go is down here at the bottom, and you can do stat boxes where it'll show you continuously what your cardiac output is.